Hello patrons, welcome to your exclusive massage video. Today I'm going to be working on the lovely Lauren and we're going to be doing a glute and back massage, and I'm going to go ahead and get started. So when I'm doing a full back massage, I'll usually include some glute. I'm going to do a more thorough glute massage working on 3 specific muscles that can help bring a lot of relief, especially into the low back. But to start, I'm gonna go ahead and do just a nice stretch. And more often than not, I'll actually start most of my massages this way. I just really like to get that nice tilt of the pelvis a little bit. It just brings a lot of relief into the hips and the back. If someone's having a lot of sciatic pain or something like that, I might not do this. Just kind of depends. This is also a lot easier when I'm working on top of a sheet, which I usually am to start. And I'm gonna go ahead and get right into some glute work. So I'm pretty methodical about the way that I approach each area. So I do like to work on this glute medius first before working on that bigger glute max muscle. So kind of start with some lighter compressions, and always with this compressive work, there's not just one way to do it. So you can do little circles, you can do just like constant pressure, and you can really just decide what's best for each area you're working on. So I'm doing almost invisible circles in this glute medius. And I do like to do a little bit of just something to get these hip flexors to relax a little bit more. So just a really easy way is just a little bit of shaking. And sometimes I'll do this with my hands on the side of the body. Other times I'll do this with some compressive work, just depends. If someone wants deep tissue and I feel like they're resisting it, I'll do a lot of distraction techniques to see if, they actually want the deep tissue. I do like to take my time with the glutes, just because you'd be surprised how much tightness in these muscles affects the whole spine, not just the low back. And I'm making the most of my time. I could start with the back, but because this can really travel up, I'd like to start with the glutes. And I'm gonna go ahead and move into the glute max. So I'm gonna go ahead and just turn my hips, and I'm gonna start with a different technique. So I'm gonna go ahead and I just don't find that compressive work alone is enough for the glute max. So I've been doing this technique for years, so I just really like doing the active release. I find that it just is really effective. So the biggest mistake that I make is trying to go too deep too fast, and it's really easy to slip off of that muscle fiber. So just kind of scanning this muscle, seeing how everything feels, just gradually starting to introduce a little bit more pressure. And also seeing, depending on what's going on in that muscle, bigger movements with that leg can be helpful, or smaller ones, little micro movements. And everybody's different. And it's important to remember that this is a big muscle, and some tautness is really important. So you're not trying to get rid of all that. You're just trying to smooth everything out and get rid of imbalances. Really paying attention to any areas that feel like they've collected muscle fiber that feels really condensed, because that's definitely an imbalance. So just trying to work out those little areas that are out of balance. This is really healthy for the muscle fiber. Even if someone is fairly balanced in this muscle, it's just great to increase blood circulation and stretch everything out. And I'm not going to really focus too much on the piriformis. So I might do just very superficially work on that muscle a little bit, but I'm not going to go too deep. And just making sure those hips stay nice and relaxed as I introduce a little more pressure. And I'm going to go ahead and do that same glute routine on this opposite side. And the thing to remember is when you spend a little bit more time on an area and you do deep tissue, you want to remember that you're starting fresh. So these muscles on this side, you just gotta do a proper warm-up. And with this compressive work, you want to make sure that your hips are angled the way that you're working is comfortable, and that you can start introducing more pressure in a way that doesn't feel like you're overextending. If your spine's twisted in a weird way or something like that, it can just make you tired really fast. So just checking in. And I've started to offer this distraction technique as I introduce a little bit more pressure. Can kind of make Lauren forget that I'm even starting to work deeper. This is really great if you're finding those little pockets of muscle fiber that feel a little bit more dense. If you can stay on that area while adding more pressure, can be sometimes more effective than moving your weight around. So like when you're doing, just little circles, can be more effective if you can just hold it. And I'm gonna go ahead and change my hip position and work this glute max. Sometimes I'll need to shake out my hand a little bit after I do that kind of work. And it's perfectly okay if you need to give yourself a little break. like just taking a breath, taking a sip of water. Those little moments are really important for you as a therapist. And I'm really not expecting each side to feel the same. There's usually differences. So just treating each side, as it needs to be treated. And sometimes if there's a lot of sensitivity, you will kind of feel your client, their muscle like fight back. And so really paying attention to that, like always working with my client and encouraging them to stay engaged in the process. If I find a spot that feels really tender, I don't want to ignore it or avoid it, but I'll usually kind of stay on there, and then I'll, revisit, kind of work my way around that area that feels really like it's the most vulnerable. And then I'll kind of just see how long I need to spend there. This leg acts as a lever, and it's also another just little distraction. So if Lauren's leg is moving, she's going to be less focused on, discomfort. Whenever I feel like there's an area that is really tender, I am sure that I'm working with my client. I'm never trying to force anything. Just really seeing how much progress I can make. And especially with glute work, I'm just really encourage my clients to be engaged with the process and really breathe through it. Because they're doing the work too. It's not just me. And making sure those hips stay nice and soft, especially as I work my way into the back. I would say with the glute max as well, you're always going to feel like you have more to do. So just finding a good stopping place is really important. And honestly, when I spend over 10 minutes on the glute, sometimes I don't even feel like it's as necessary to do as much of a warm-up on the back. So it just kind of depends. And especially when I do that glute and hip work with these effleurage strokes, as much as I can, I like to bring that stroke into the hips just to tie it all together. You do need to make sure that your client feels comfortable with that. And I'm going to start to work the heels of my hands into these muscles that support the spine, bringing that all the way into the hips. on my way up, I like to grab hold of the lats. I actually feel like this stroke will usually warm up this way, but I really like using a soft fist. I feel like I get a better hold on these erector spinae, so I just like to work my way down and into that thicker connective tissue along the iliac crest. And not as easy to grab hold of the lats with that technique, but on the way up. And I'm focusing a lot on just this area around the iliac crest, so just really encouraging all of that to let go too. After that great glute work that we did, this can feel really, really nice. This is kind of the simplest way that I found to work along this area if I don't have the time to use different technique. Go ahead and do one more. Nice, long, slow stroke. A little bit more along the iliac crest. Really sinking my weight into that connective tissue as much as I can. Noticing a little bit more going on the right. So and I'm going to start bringing my attention into the upper back a little bit more. And still kind of just working along those traps a little bit. I mean the lats. And then sinking my weight in a little more to get that upper back. And this is a technique that I'll do if I don't have a lot of time and my client wants deeper work in the shoulders. Instead of walking from side to side, which takes a little more time, sometimes I'll just start with the rhomboids. And I'm not really using a whole lot of pressure here. Bringing that into the traps, into the neck. And what you can do is you can use both elbows and just wrapping around the scaps, the scapula, into the upper trap, into the levator scapula. And sometimes if I want to work with a little bit more detail, I'll just keep one elbow stationary and then start just working my way around the scap. I don't find that this is as effective as when I actually walk to the side of the table, but it's pretty good if you don't have a lot of time. I feel like I can't use quite as much finesse as I would like, but it still is a great technique. And especially if my thumbs are tired, but I want to do something a little bit deeper. And always ending with something that just feels nice. So just a nice long effleurage stroke, at least one. towards the end of a massage, you're usually feeling a little bit tired and you're ready to kind of wrap things up. But it's really important, even on these last few strokes, to just give it your full attention and not to rush. Always taking my hands off nice and slow. And that is all for today. Thank you so much for your support, patrons. I hope that you enjoyed today's video, and I look forward to seeing you next time.